Hi, my name is Emily Sutton. I'm the clinical pharmacist here at the Community Health Center. My job is to help patients with their medications. Today I'm going to talk to you about how to get your medications, how to use your medications, and how to be safe with your medication. When you first come to the Community Health Center, you may have already been on medications. If that's the case, we will do our best to continue the medications that you are already on. Sometimes we may need to change them. Sometimes medications are given to help prevent future problems. Sometimes medications are given to treat problems that you have. You can always ask your doctor these questions to make sure that you understand the medications that you will be given. You can ask, how long will I take this medication? What is this medication for? How will I take this medication? How many times a day do I take this medication? And will this medication cause any side effects? Sometimes, whenever you come into your appointments, your medications have changed. Sometimes it's because you've seen another doctor. Sometimes you may have stopped taking a medication. It's very important that every time you come in to see the doctor, that you bring your medications with you. All of the medications that you take, including prescription medications and medications that you may have gotten over the counter that were not given a prescription for. It is, again, very important to bring all of these, even if you don't take them very often or you think that they are not important. Some medications are given by mouth. Some medications are inhaled. Some medications are injected. You can always ask for help if you are not sure how to use the medication that you are given, especially if it's a medication that is not taken by mouth. There may be special instructions that we want to make sure that you are very comfortable with before you start taking the medication. And these instructions may also ensure that you're using the medication effectively. Sometimes it can be very confusing when you have a lot of medications to take. We understand that, and we want to always be able to help you to make sure that you know what medications that you're supposed to take and when you take them. If you are having confusion understanding your medications, you can ask for help. We can give you help by writing your medications down and saying, this is what you take in the morning and this is what you take in the evening. And sometimes we can give you what's called a pill box. You can use these pill boxes to put pills in every day. And we can give you more than one if you take medications more than one time a day. This helps to organize your medications for the day and for the week so that you do not have to look at each bottle every time to remember when to take it. So whenever you get a new prescription for a medication, the doctor will send your prescription to the pharmacy of your choice. Some pharmacies deliver, some you will need to go to the pharmacy to physically pick it up. When you go to the pharmacy, you will need to give the people at the pharmacy your name, your date of birth, and your address to pick up your new prescription. When you go to the pharmacy to pick up your prescription, the information that is very important is on the label. Please read all of the parts of the label to make sure that you know that this is your prescription. Your name should be on it. Please make sure the name matches your name. There is also a prescription number. You will need this number if you need to get more medication. There are also directions on how to take this medication. It will say, take 1 tablet by mouth every evening. Or if there are other instructions for your pills, it will say that. But all of the instructions that you need to take your medication correctly are right here on the label. And if you need help understanding what this label says for how to take your medications, please ask. The label also says what the medication name is and what the dose is. That's very important so that you know what the medication that you're taking and the dose is in case your doctor ask for this. Another important part of the prescription label is how many refills. Sometimes on an initial prescription, you may get a 1-month supply. Sometimes you may get more. You will often need to continue to take these medications. It will say on the pill bottle, on the label, how many refills you have. So if you have more than 1 refill left, you can just call the pharmacy to ask that they give you more medication. And that way you know how many refills you have left on your medication. This pill bottle and the label also tells you what doctor wrote this prescription for you, so you can remember who to ask if you have any questions. And last, another piece of information that is on the prescription label is the name and the phone number of the pharmacy. So you know if you have any questions or you need to call in for a refill, that you can call the phone number that is on the label for the pharmacy that's listed. So now that you have picked up any prescriptions from the pharmacy, you may wonder how to pay for your medications. Many times, your insurance will pay for most of the medication cost. If ever you have a problem being able to afford the medications that you have been prescribed, it is very important that you let us know here at the clinic, or that you let your pharmacy know that you are having trouble paying for your prescriptions. There are sometimes things that we can do to help, and sometimes there are programs that are available to help you pay for your prescriptions. It's very important to take your medications, and we feel very strongly that we can find you the assistance that you need if you're having trouble paying for medications. But we must know if this is the case, so please make sure and tell us or the pharmacy if medication costs are too expensive for you to be able to take them. So I'd like to talk very quickly about medication safety. It's very easy for children to mistake pills that are often brightly colored for candy. So please make sure that you always put any pills that you have in a place that children cannot reach them. You can also ask for child-proof caps on your pill boxes. Sometimes the pills are very easy to open, and sometimes the way they put them on, it makes it hard for children to open. So we want to make sure that if you have children that have access to medications, that they are safe. I'd also like to talk about where to put your medications. Many medications can be kept out at room temperature. What they cannot do is be very hot or in a place that's very humid, like your bathroom. A very safe place to put medications is somewhere near your bed, which is often at a nice dry room temperature, or if you store it in the kitchen, you want to make sure it is not above or near the stove or on top of the refrigerator. Some medications may also have special storage requirements, especially something like an injectable medication. If you have an injectable medication, please ask if this medication needs to be refrigerated. We care very much at the Community Health Center that you are able to take your medications and take them effectively and safely. We have many resources available to help you with this. So please remember, anytime that you have a question or concern about your medications, that we are here to help. We have many resources to help you that we can access just by you asking. So please do not feel afraid or embarrassed to ask for help if you need help with your medications.